two pivotal studies has been presented in the few not distant years, the DESTINY-Breast04 and the DESTINY-Breast06. I want you to give us an overview about those two studies and their findings.
Certainly. I mean, prior to DESTINY-Breast04, and it wasn't that long ago, but it was such a major frame shift, it was hard to remember the thought process from prior to DB04, where we looked at HER2 as binary. It was positive or it was negative. You always had this sneaking suspicion and inkling that, you know, probably some of your 2 pluses or those 1 pluses who were FISH positive, you know, maybe they were going to be responding to HER2-directed therapy, but we didn't have any evidence of this until DB04. So DB04 randomized in a 2-to-1 fashion patients who had progressed on endocrine therapy and also in a line of chemotherapy, and randomized them to either T-DXd or treatment of physician's choice. And the list of the chemos was pretty exhaustive. And then showed us the results. And these were all patients who were HER2 low. Yeah. So these were patients who we had previously would not have considered for HER2 directed therapy. But using an antibody drug conjugate with its bystander effect gave us possibly a greater opportunity to be able to sort of enrich the population who was going to benefit from ADCs and to capture that population before they had to move on to really the scary and frightening and side effect prone hair loss, chemotherapy. And so that's where we met DB04, which represented a clinically significant progression-free survival over chemotherapy.